The Nurses Association has got your back, Maclean. We're going to put up a big fight. One of my colleagues termed it a mega ward. The plan was to move the acute ward from level 2 down to the subacute and rehab ward. So you'd essentially have, you know, your patients, you can have a cardiac patient that's being on telemetry in a room. Next door you might have, you know, someone that's dying in their last days of life. So it was going to be this massive mix of patients. A lot of the staff, their biggest concern was that we only had one single room, so what was going to happen with the infectious patients. Well, we called a staff meeting for the following day on the 12th, and we discussed it and decided to hold a community forum, get the community behind us. So yeah, we got together pretty quick and got stuff organised. All the staff there were sharing it all over their Facebook, were talking to anyone that would listen. I emailed an invitation to the CEO of the area health and quite a few of the senior members. The CEO replied saying that, you know, he was out of town and wouldn't be able to attend, but they would be holding their own forum, and that negated the need to attend ours. I think there would have been about 100 people there, but people were very angry and they didn't believe what the executives were saying. I found them very defensive. My belief is they were just repeating what had been said in the press releases. The one that the association hosted was the following night, and there was standing room only, and it was about 35 degrees in this.
We really don't want this to happen, and we're going to do our best to stop it.
A lot of their concerns were very similar to what the staff had, that there was no community consultation. The Maclean community is very passionate about their hospital. They've got a sense of ownership. The emergency department there was paid for from a bequest of a community member. So not just a nursing thing, it's everyone at the hospital, it's a community thing. Narelle, who was one of my colleagues, someone approached her after the forum for wanting a community march / rally. So we got our heads together to start organising that. It was the Wednesday after we'd held our community forum. We had word that they'd put the proposal on hold that afternoon. Everyone was so happy and elated, and there was high fives and air punches, and there was this great mood. It was like this big weight. Everyone was just so much happier, and it was lovely to walk into work. So we're now getting quite a few new members because of this. I was running around handing out membership forms. One person can't do it, but look at how we all came together and worked together, and it was the power of the people. And I mean, at the end of the day, I believe it was the community backlash that got the hold put on the proposal. It was amazing.